Good afternoon. I'm Jim Palenick, Middletown City Manager. We're coming to you today, December 15th, 2020, on what really is a pretty momentous day and a pretty momentous week. I'm with Public Health Commissioner Jackie Phillips Carter for the City of Middletown. And Jackie, we've been through a really difficult year, but we had something occur this week that's really momentous and really important, and that is
Excellent.
the FDA for the first time approved an actual vaccination for the COVID-19 virus. So if we could today, can you tell us a little bit about what to expect in terms of when the city of Middletown will actually receive the opportunity for vaccinations? Who will be first? How do you prioritize? Kind of just walk us through what the expectation will be here on the ground for people in Middletown.
Great. Well, thank you. It is very exciting. The FDA, I do believe, and everything is moving so quickly, has approved 2 vaccines now. So we are looking at the Pfizer vaccine that we had heard about last week, and Moderna is right on its heels. And so some of my emails coming through, it appears that has been approved as well. These are 2 new vaccines that we're really excited about because we are seeing light at the end of this long dark tunnel. And so we are really excited. Everything is pretty much fluid. We are pretty close to knowing who gets vaccinated first. So Ohio has received their vaccine. That vaccine went to, I think it's 10 hospitals. These hospitals are large, huge hospitals. You've probably heard of Ohio State and Cleveland Clinic and UC. So some of the hospitals that are really large, that are connected with large universities, received some of this first Pfizer batch. And they should start, I do believe they start vaccinating as we speak. It's ongoing right now. So that's the healthcare workers.
So Jackie, will the city of Middletown see any of this Pfizer vaccine, or are we likely to be on the second or third round?
Right. I think it is pretty sure that we are on that second round, the one that is really close and ready to go, which is Moderna. We should be receiving it any day now. It's more, if I was going to give you a time estimate, it may be next week or the end of this month, but we're really close to the end of this month. And health departments around the state will receive different amounts, different allocations for, and you'll hear this in the news as we talk about this more and more, that 1A tier group. And that 1A tier group is going to be the people that are the most at risk of infection or disease. And that looks like a common group is EMS, right? They're transporting people. So if the large universities are going to, and hospitals are going to vaccinate their staff, and that's the ones that we take our sick patients to, then who transport them there is EMS, and then we start going who else are high risk to get these first vaccines as they start coming in.
So describe for us some of the folks that wind up in that what we would call high risk group, that tier that is likely to get vaccinations earliest in the process.
Right. They're going to be, and this is pretty much an all 1A, this would be healthcare workers. Now remember, when we say healthcare workers or healthcare staff, that is not only doctors and nurses, that is radiologists, that is people that serve you your food, that is people that clean and sterilize the instruments. That's everybody in that hospital system because they're at high risk. They're coming across the patients. So when people just think doctors and nurses, no, it goes beyond that. And that will then be EMS, the people that are transporting the patients. That would be the patients themselves. I do believe that some of the systems will have residents vaccinated as well, again, because they're high risk. They're in that setting. We can look at congregate settings such as DD, people with disabilities. They're in a setting which is high risk and they're a closed setting. So we start teasing out all of these different subgroups, if you will, that starts being vaccinated.
So how about like nursing homes? If I have an elderly mother or father in a local nursing home, and is the staff there going to be vaccinated? And how about the residents?
Absolutely, and that's a good question because this is different responsibilities, if you will. So CVS and Walgreens has a contract with the federal government to vaccinate long-term care facilities. So they will be going in for the staff of those facilities and for the residents in those facilities. So they'll be taking care of a lot of those. And then public health will take care of ones that may not fall in their range. Sometimes they do the bigger ones, and we have what we call mom and pop ones that may be smaller, and public health would then be responsible to do those vaccines.
So public health, your staff, you'll
Yes.
be doing some vaccinations. Who are likely to wind up coming to get vaccinated with you, and what's the timing for that?
Okay, if we receive vaccines, and it's my philosophy, and this is all fluid, if I have something that can save you or help you in my hands, we're going to get it out as soon as possible. So if we were to receive it Christmas Eve or Christmas Day, holidays would not matter. We would have a small clinic set up. So depending on how much I receive. So for instance, if I had 50 EMS and I received 50 doses, I would get those doses out immediately to that group of people. So we'll work down that 1A. Once we start getting vaccine flowing in, we'll start doing the highest risk population until we get to what we call that mass vaccination piece. And that will be everybody that can get a vaccination will be at those clinics. And that's to come, we're thinking around spring.
Okay, so your best guess for the general population here in Middletown, if they're sort of eager to imagine when they might be able to get a vaccine, what would you predict that would be?
I would say April. Look towards April. This is coming out fast and furiously, and we may do it sooner than then. But most people are thinking April. It would be a wonderful goal if by summer we would have the majority of the people that want to be vaccinated. And that would be depending on how much vaccine we receive and how many clinics we can actually get through.
Now, what do you say to the folks who are a little bit cynical? They know that this vaccine was developed pretty quickly compared to historical standards. They're worried about, whether it's really been tested out well. What would you have to say to folks who are kind of concerned early on whether or not they should get a vaccine?
Right. I would say good for you. We need to be mindful. We need to be educated in what we're receiving. I always say be a good, strong advocate for your health, right? So we need to look at all of that data. We need to talk to medical professionals that will give us good, sound advice, especially medical professionals that we trust. That's the first thing. This has been reviewed by many people, and it appears to be very, very safe. Any kind of medical vaccinations, you have to look at the long haul. Sometimes it's not about being safe or unsafe. It's about being, you'll hear that word, efficacy. It's about whether it's effective. Why shoot people and hold them accountable and then it doesn't work really well? And so it has nothing to do with being safe. So I would tell everybody, listen, keep your ear open, conversations like this, and find out where you feel comfortable. No one should be mandated to do anything unless it's in a line of work, of course, like military. They're a lot of times mandated. But I always tell people, just listen and watch and listen to your friends, listen to other medical professionals, listen to science. Really and truly, and we'll get there. I was concerned at first because everything is always new. And I'm older, and older people tend to get concerned more, like, oh, this is awfully fast, honey. But we have to realize that with technology and funding, that was a big thing. This was able to get a lot of funding to push a lot of things quicker. And so as we move through this vaccination period, I am very confident that the vaccine is safe. I'm confident that the future vaccines will be safe, and we can get our population vaccinated and back to a close to new normal. So I am going to be strongly recommending that everybody that can get the vaccine, because as it rolls out, it'll be people that may not be able to get the vaccine, but those that can will.
Well, Jackie, I'm older too, and I strongly encourage everybody to get the vaccine as well. And I too strongly believe in this. I believe the science is there.
Yes.
I believe that the work that's been done by so many people for such a long time really will have made a difference. And I would be the first one to be standing in line as soon as you make those vaccinations available. So if it helps in any regard, I think as leaders of the community, we should be out there encouraging people to get this, get it done. And in the end, it's going to get us all closer to normalcy a lot quicker.
Absolutely. And we will find too that there will be people, everybody should wait their turn, right? As far as when they're in line. But there may be opportunities for people, just like there's been a lot of studies out there for people to be a part of. So it may be opportunities for people to participate in getting some of the vaccine out. And if they volunteer on some of these initiatives, they may become available or eligible to get the vaccine because they're going to be a frontline worker. It's almost like if you were to help the EMS and you're out there. So
if you
stay
need
tuned.
volunteers in
Absolutely.
the future, we will certainly be back to let the public know
Absolutely.
how they can participate.
Absolutely.
Great.
And can I say one other thing, Jim?
Absolutely.
I think we shouldn't discount people's hesitancy or their concern. We have had a lot of history, if you will, with different cultural history with medicine and medical, and they talk about now that people of color may have some hesitancy. And I am a person of color, and I talk to them all the time. And I want people to understand that if you have the science and you're comfortable with your doctor, comfortable with what people tell you to do, comfortable with what leaders are telling you that's safe and effective, they should fall on that. But we will not discount people's thought processes or
Absolutely.
reasoning, because that's very important. That's a part of building trust with your community.
Without question, and I think we get ultimately to getting everybody involved.
Absolutely.
Because people believe in it, they trust it, and it's working.
Absolutely.
So you can't get there by forcing people, by mandating it. I
No.
agree 1,000%.
Yeah.
So the key is quality encouragement, leadership showing the way, and ultimately having this thing succeed. So
Absolutely.
we look forward to working closely with you.
Great.
Thank you, Jackie.
Mhm.